Now it is visible now.
Yes, yes, sir. A very good evening to one and all. I am Arpita from the IGCP group. The topic that we are going to cover today in our webinar is breast carcinoma. Can we conquer? And yes, I'm very glad to announce that we have with us today Professor Dr. J.A. Jayalal sir. And it's an honor for me to welcome him and to introduce him to everyone. He is an accomplished surgeon with an impressive array of qualifications and honors, holding degrees such as MS, DLS, FIACGS, FMAS, FICS, FACS from USA, and PhD in surgery. He is currently the professor and head of the Department of Surgery at Kanyakumari Medical College. A distinguished academic and educator, he serves as a PG teacher and has earned fellowships from prestigious institutions such as the Royal College of Surgeons, FRCS, UK. Sir also holds significant international roles, notably as the Secretary General of the Commonwealth Medical Association, UK, demonstrating his global influence in medical leadership and policy. His advanced surgical training includes specializations in laparoscopic and minimal access surgery with credentials like DLS from Germany, FIIOPM, and FMAS, further highlighting his expertise. Additionally, he has achieved an MBA, blending his clinical expertise with managerial skills. His contribution to medical education, surgery, and international healthcare collaborations are highly recognized, making him a thought leader in his field. So, with this like very little introduction of Sir, I would now request him to please start with this topic. Over to you, Sir.
Thank you. I mean, my greetings to you all. I'm so happy to be with you at this moment once again with IJCP and always remembering Dr. K.K. Agarwal and this group. It is my gratitude that I'm participating in it. I'm sure that this is one topic which I just want to share with you is about the breast carcinoma. Normally in October month we celebrate as a Pink October. That is means to just to remind the people about the carcinoma breast is one of the highlighting month is October. So as we are nearing that month, I thought that this topic can be shared with you. We know a lot of lifestyle diseases in the country. Though breast carcinoma is not typically a lifestyle disease, but a lot of factors in the lifestyle is going to contribute to this carcinoma breast. And if we can do something on these lifestyle diseases or lifestyle problems, and we will be able to reduce it. That is on one part. Second part, we have improved quite a lot in the diagnostic procedure. We can early diagnose the disease. And the third is a treatment part. And now, almost, if you are able to diagnose in the early part, we are able to get 90-95 percentage of disease-free survival for the carcinoma breast. So that means we are, though on one hand, the carcinoma breast surgeries have been increasing, but we are also on the side of conquering that, but we need the cooperation of all faculties, all the doctors, and all the even patients to come early. So I'm just to encompass all these things in this topic, and I'm not sure that how the audience are going to be, but I will skip very high intensity topics, high intensity things, and I will be concentrating more on the which all of us can understand on. So first, we must remember that the carcinoma breast is becoming one of the commonest malignancy in the female. If you see 1990s or 1980s, and carcinoma breast was not the highest number of, this is not the most common disease. It's the carcinoma cervix. A lot of viability and a lot of screening programs were implemented. Lifestyles of the people were also changed. So now carcinoma cervix has come down, but on the contrary, carcinoma breast has been quite enormously, it is increasing, and almost 1.38 million people. That means nearly 14 lakhs people of or breast cancer are developing every year. Every 4 minutes, an Indian woman is diagnosed with a cancer. Not only that, and we have an enormous death, nearly 4.58 lakhs. If you see the entire COVID, the death of the entire COVID is only 5 lakhs. Though we have a 5 crore people who are affected, but the 5 lakhs was in that means that less than 0.1 percentage or 1 percentage is a death. But here, if you see 14 lakhs people are affected, but 4.58 lakhs people are died. So that is a big challenging one. So one woman dies in breast cancer every 13 minutes in India. So it has one of the longest history. It is even in all of our original areas we see that is a thing, but this is becoming the largest. The second leading cause of death in women is carcinoma breast. Such a phenomenon. So there are so many other diseases, including cardiac disease, including the accidents and whatever it is put in there. If you see the 100 people are dying, that is a commonest second cause of death. It's so if as we see there is a 11.22 out of 12 percentage of uh, population one is developing this disease. That means every 1 in 8 women in their age group, if they are passing through, there is a possibility they are going to get this carcinoma of breast. And if you see this is a high burden countries on that. For every 1 lakh individual, if you see India overall, we have 31.3% of the people are affected. But if you see certain disease like Kerala, it is almost like a 45.7. It is the highest number in the Kerala. And even in a states, it is a metropolitan cities. Delhi metropolitan city have nearly 48% incidence. So that is one incident. And if you see this second side, the graph, and if you within the 25 years, almost there is a doubling of this number of cases. The more worrying thing is not only that. If you see the Africa, the North America, if there is 100 people are diagnosed as carcinoma of breast, the death is only 17 percentage. But if you see Asia, if we are having 100 people are diagnosed with the carcinoma of breast, nearly 34 to 35 people are dying. So there's a vast majority. Though we say it is a disease of the metro cities, yes, in Western countries also it is rising. But the benefit is they were able to conquer the disease, and the number of people dying with the carcinoma of breast has drastically reduced in those countries where it is only 15 to 16 percentage or 17. Even US it is coming nearly is 15 percentage of only when able to secure. But in India, we get, especially in North India, it is nearly 45 percentage of the people. If the 100 people are diagnosed to have a carcinoma breast, and they are not able to survive for 1 year. So this is a very pathetic situation where that we need to put. So the number is drastically increasing. It is irrespective of the age group. And if you see the
Sir,
lowest year, ah,
so sorry to interrupt. So your slides are not moving. They are not changing, sir. Yes, yes, yes. Now they are changing. Yeah, please continue, sir.
probably I may not go for the full screen. Can we, the screen is okay? This is okay.
So can you click on play once?
No, play means it is so slowly changing, huh? Probably. Okay. So this, if you see
Sir,
this
sir,
is
sir, so sorry to interrupt. Sir, previous one was okay. Um, the previous layer, yeah, this is okay, sir. You can play it like this.
okay. Okay. So now if you see, even at the age of 25, we have seen people are getting the carcinoma breast. Although we say it is a highest age group, so there is no age group, even the younger age group, nearly age of 20, and the carcinoma breast is occurring. So this is one area of the problem for us, because this is going to be a huge disease which is going to affect the people in a large number. So, what are the challenges in front of that? Now we know that this is a disease, and how we also know, when we are able to make the diagnosis much earlier, that we will be able to cure the disease. So, when we see a 1 centimeter mass in the breast, then what do you think the probable time of origin? Now it is been calculated. The cancer might have started 5 years earlier. That means it is starting as a one cell, and to multiply and become a 1 centimeter size, it takes nearly 5 years. That means 30 doubling time. One cell becoming two, two cell becoming four, four becomes eight. That we call as a doubling. So it almost take 30 doubling for to become a visible mass. So by the time you make a diagnosis of a breast carcinoma with a swelling in the breast, that is, it is already 5 years gone. And we are missing the opportunity of the early diagnosis, early screening, and what best we can do. And again, the problem is, it is not that the swelling, the tumor, usually the carcinomas of other carcinoma, they tend to migrate or metastase to other parts after becoming a visible tumor. But here, even at the time of 27th doubling time, that means still it is not visible as a mass. It will start disseminating through the bloodstream. So the carcinoma breast is no more, it is considered as a local disease. So it is called as a systemic disease. That means even before it has been visibly appearing, it takes 20-30 cycles. But even at the 27th cycle, it will start metastasizing to the blood, and that is going to have a greater problem for them. So if you see again, 100 people are going to get a cancer, and many times we say hereditary cancer, the family, yes, it plays a role, but 80 to 85% of the time it is sporadic. There is no, may not be, there is a family history. If you see this slide, it is only the typical hereditary, that means from the maternal side or the paternal side, it is a crossing is only 5 to 10%, but 65 to 75% of the cancer is coming only through the sporadic or for various reasons. So what are the, so there is what my intention of you talking to today is identifying certain the risk factors which are there, which is going to make more vulnerable a patient. So if we can adopt to certain styles and certain things, then we will be able to reduce. So being a woman itself is a great risk factor that we cannot change, and that is of course, and aging, as the age advances and you are going to get a disease, so that cannot be there. But remember, when you have a lump in the breast, and it is only the 10% of the lump in the breast is only malignant. If you have a lump, and if you make any investigation, 90% of them are going to be a ordinary lump. So just because you are going to have a lump and which you are making, and do not get displaced, do not get a problem, because it is only a small amount of the 10% of the things are going to be the problem of the lungs going to be changing that situation. Okay. So breast cancer, I mean risk. That is what we are going to talk about now. A little more. See. So lifestyle choices could drastically impact the chances of developing the breast cancer. See, what are the lifestyles? What are the problems? This we will be discussing. So one thing which, if you want to reduce your carcinoma breast incidence, the physical activity and exercise prevents the breast cancer formation. So now, normally we know for sure the 99% of the carcinoma of the breast is going to occur in a female. The male get only 1% of the breast cancer. So 99% of the breast cancer is there. There is a studies prove, and when you are physically active and you are moving around, you are the doing work, you are going to be prevented. Being a fit, 25% reduction. Somebody who is a sedentary lifestyle, somebody who is working around, moving around, doing the lot of job and doing the exercise, walking around, not always using the all the high tech sophisticated equipments, but doing the manual works, and that is going to prevent you getting 25%. That is a big news, because once you are going to do an exercise, and you can do, because the physical activity lowers the one of the hormone which we talk about the carcinoma breast is the estrogen. So wherever there is a estrogen is increased in a normal menstrual cycle, you are going to have two hormones, progesterone and estrogen. If by chance there is a progesterone is not there, only the estrogen is going to be secreted more, you are more prone for the development of the carcinoma breast. So the exercise reduces the estrogen and other related growth factors which are going to help you. So what is exercise means? At least 150 minutes per week. That's all what is we are expecting. And if you are going to walk for 5 days, 30 minutes, and that is going to tell that is a 25% chances of you getting the carcinoma breast is less. Or if you are having a marathon or a vigorous walking, even just 75 minutes per week is good enough. But physical activity plays a significant role. Why we say this? So one end we are saying that this is because of the estrogen level is low, but on the other hand, it is also true because the estrogen level, the physical activity reduces you from becoming an obese person. Because obesity per se is also going to be the main reason which is going to have an impact on your the way how you are going to get the disease. So not only that, even you have a minimum good sleep, If you have a lifestyle, you are going to have a proper sleep. That is a one hormone which we have, a melatonin, and which is going to help you in prevent the development of the carcinoma breast. So that is going to be of a great help. And obesity, this is a one major problem now we are getting with the women in our country, because starting from the younger age group, even from the childhood, the people are becoming more obese because of our lifestyle, junk foods what we are taking, lack of exercise what we are doing, and the hormonal change, all chemical foods are coming. It is there, especially on the postmenopausal woman, because in the body normally the ovary is secreting the estrogen. So the body manage with the estrogen from the secreted body. So once you become a menopause and after your menstruation cease and the ovary is not functioning, so all that the estrogen what you are going to produce is the peripheral conversion of the fat, which is the estradiol, to estrogen. The fat which is going to accumulate in the periphery is going to get converted into an estrogen. So again, remember, estrogen is the villain. That is what is going to have a damage in the breast carcinoma. So when you have more fat in the body, especially after your menopausal period, 45 years, 50 years, and you are going to eat more, less exercise, less working, and sedentary lifestyle, got retired from the job, and no other work, and that means, and you eat junk foods, then you are going to have a lot of fat which is going to get converted into estrogen, and that is going to create the increase in estrogen. And the also these fat cells will stimulate the insulin and growth factors, that can the insulin growth factors can develop to the metabolic syndrome. And also these fat cells will go for the atherosclerotic changes because of the inflammatory phenomena which is taking place. Because so the culprit here is your lifestyle and the food, and the more the food with oil and other things, and the more the sedentary lifestyle, and you are going to have a peripheral obesity, peripheral fat, which is going to get converted, or which is going to stimulate the estrogen, and thereby you are going to get more chances. The third is an alcohol. And we may say that why you are talking about alcohol for a woman. You will see the next slide, and how rampant it is. That there is a reduction in the 15 percentage if you are not taking alcohol. The chances of you getting, so physical activity with the metabolic is going to reduce your 25 percentage possibility of getting the malignancy. Then if you are not having alcohol, and if you are not taking alcohol, or taking alcohol very mildly, or taking, then you are going to have some immunity on from getting. There are various reasons, because alcohol per se contains the phytoestrogen. It is created from the plant origin, that is there. Alcohol per se stimulate the estrogen. Alcohol per se develop aldehyde, which is damaging the DNA. So thereby it is synthesizing the metabolic changes and producing a carcinoma. So alcohol is one disease. So now a recent study they had done, and 1,000 people in the UK, they undergone, how many people are reading it? So out of 1,047 people are not taking alcohol. 260 people are taking 3 units a day. 140 takes 3 to 6 units per day. 120 takes more than 6 units of the alcohol. Maybe in our village, maybe in our very religious setups, very less. But in the metropolitan cities, in the hotels, in the 5-star hotels, where you are seeing that there's a number of women taking alcohol is increasing. So the more the alcohol increase, that is a one reason what we are getting the increased number of carcinoma breast is alcohol, which is being rampant at that. Second, again, smoking. So if you are smoking, then there is a 10% increase of you are going to get a carcinoma. Again, it is very painful to see now most of the time in the airport, in the lounge of the smokers lounge, we are now getting equal number of women are going there, because they take it as a style, or it is something expressing their modernity. I'm not talking on the basis of the sex, but it is in the, because 99% of the carcinoma breast are going to be affected in the female. That is why we are concerned, and we are going to talk about on that. So reduction in the smoking is going to help when if you are not smoking. There are certain foods when we are taking not much of oil, not much of the fat you are going to take, but if you are going to take more of the vegetables like legumes, onion, you have fish. If you are taking the fatty fish, the garlic which you are going to take, the citrus fruits. Then once we say now orange is the new pink. Pink is a color which always maintained to say the protection to the breast carcinoma. So now there's a new color is being added to the pink color. It is orange. So whatever it is in orange in color, whatever is having rich carotenoid rich foods, and that reduces the breast cancer by about 19%. So if you put all together, you will be we have a lot of chance. Out of the 85% of the cancer which we are having, the number of people going to be affected is going to be very less. So what are the carotenoid rich food you are going to have? Even your mango, your tomato, we are going to take papaya, you are going to have, or your the pumpkin, or the sweet potato. See, all these are the protective factors. So if your diet is going to be on a orange based, orange is the new pink, there is a slogan now which we are talking, and that is going to help you to reduce your carcinoma of breast by another 19% possibility is less. So this is one chart which we all know, Mediterranean diet chart, which is very common, because it doesn't say no food is forbidden. No food is forbidden. You can take non-vegetarian. You can take, but physical activity, more of the legumes, more of the fiber foods, more of things is going to be helpful for you to make it more in use. So if your lifestyle is converting to the Mediterranean food lifestyle with a pyramidal cycle, pyramid of the meat and the fish coming at the top with a little, and the base is fully with your fruits, and that is going to help the food. So alcohol, when you are reducing, lifestyle, when you are making sedentary lifestyle, you are changing to the active and physical exercise you are doing, you are almost there. So this food plays a major role, because now a lot of studies have come for the gut microbiome. We know whatever the foods we take, and we have a lot of microbiotics, or the bacteria are there inside the stomach. So now we have gone to the extent of making a person and study his tool or his bacterial mycobacterial structure inside the colon, and do the DNA analysis, and can predict that whether this person is going to get a carcinoma of breast, or whether this patient is going to get benefited by giving a chemotherapy, whether this patient is going to get benefited by doing a radiotherapy. So all that can be now studied. So this is another booming field. Now, a lot of studies are being done on the gut microbiome. So your gut microbiome is going to decide, and that gut microbiome is also based on your genetic makeup, and also the food you are going to take. The more the food, the fruits and vegetables you are going to take, there are good microbiomes are going to come, and that is going to decide that person. So whether you are destined to carcinoma, or whether the environmental factors came to the carcinoma, now it is being well preserved that environmentally factors and the lifestyles are going to put. There is a lot of studies that's going on the gut microbiota and that. And still we have few more important things which one going to do is going to help you to come out of that. What is the most important thing is a breastfeeding. Though we say that is a woman are going to get the more carcinoma, but you have the greater opportunity to get rid of that, because once you feed the baby, it is not only enriching the baby, but you also protecting the mother. So breastfeeding, the if you are giving a maybe a minimum 1 year, at least for a 6 months exclusive breastfeeding, and that is definitely going to be, there is various reasons, because the amenorrhea which is going to be there, and as long as you are going to feed the baby, you are not going to have the menstrual cycle. That means your progesterone will be more, the estrogen will not be there much, so the estrogen will be less. And secondly, during menstruation, during breastfeeding, it is natural tendency that you take more foods, and you are very cautious about food. And in the Western countries, they avoid smoking and alcohol whenever they feed the baby. So the breastfeeding is one of the golden time that it is going to safeguard the mother from getting the breast. So we say, we sometimes we say it is a reward of disappointed breast. The purpose of the breast is intended to secrete milk and give to the babies, and when that is not being carried out, when that is the function of the physiological function of the breast is not being carried out, they are going to have the most chances of getting the carcinoma, because of the prolactin secretion, because of the hormonal effect, because of the lifestyle they will be following during the time of the menstrual lactation. So that is going to be a great help. So when a woman is coming, then there's a lot of modifiable factor and non-modifiable factor. So certain things are non-modifiable. Your sex is not modifiable. The age you are going to become is not modifiable. The family history, someone in the family of you is having a cancer, which is not modifiable. But on the other hand, there are modifiable risk factors. So one is the hormonal replacement therapy. This is another major problem where the woman takes a lot of drugs in the post-menopausal period. You are going to take the hormone replacement, HRT we say, the estrogen creams, vaginal creams, and the tablets which you are going to take to replenish your body. And they all are potentially hazardous of taking them. But we do not have any ample evidence to say OCP, the oral contraceptive pill, is more prone for, unless you are going to use it for quite a long time and continuously using. The incidence of carcinoma on a OCP is very less. But HRT, but the hormone replacement therapy, definitely there is a more possibility that you are going to have this. So again, whatever I said, physical activity, overweight, alcohol intake, smoking, and food intake. So all these are modifiable risk factors. So if you can take a willingness to take the modify these factors, then definitely you will be able to do some extent. So now, can the science today, the medical medicine can predict whether this you are going to get the carcinoma breast or not? There are a lot of the tools are there, which are programs are there, which the certain questionnaire will be asked to you based on this question, and that we will be able to predict that how much. So suppose age of the person is, when you are age high, you are more prone. And this is two things are important now: age at menarche and age of menopause. Age at menarche, now normally in the olden days the people get menarche at the age of 13 or the 14. Menarche is the first menstrual cycle, and 13 or 14. But now we see menarche at the age of 9, 10, the early menarche. So what is the problem in the early menarche? When they are early menarche, the cycle, we call it as an anovulatory cycle. Anovulatory cycle means they will not get the menstrual once in every month regularly, because there is a hypothalamus pituitary axis is not well developed. The estrogen progesterone secretion pattern is altered. They are going to have anovulatory cycle. So as long as it is an anovulatory cycle, the incidence of exposure to estrogen is becoming high. So in the premenopause, in the early menarche and late menopause, early menopause, the people are more prone to have the increased estrogen levels. So that the second most important is age of first live birth. So now again, this is again a major problem where we are going to have more cancer, because we recommend the age of the first child must be 21st. It's an ideal, because that is what the Western literature says. If your childbirth, the first baby is born by the age of you are 21 or 22, and you are protected. When the more the late, the 25, now we are getting, especially among doctors, we are seeing marriage around 27, 28, 29, and that are going to be there. And when we are having a family history, if someone in the family is having a carcinoma, you are. So there are a lot of models which say, so person the Gale model, if you are having 1.6 as a score we are going to get, and then we can say that you are more prone to develop a carcinoma of breast. So something can be done to prevent the further progression. That is that. So there are different models. I'm not going to the details of each. You have a class model, you are having a BRC, a pro model, tyrocusic model. Each is a specific, and these are the questionnaire pattern, or these are the algorithm pattern which we put on the patient. We get the information, and with that information that we will be able to make a diagnosis whether this there. Then a lot of molecular testing is also there, and normally we do the molecular testing, and based on the molecular testing, now carcinoma breast is now this is a very important thing, because now previously it was for everybody, we say with the carcinoma breast surgery or radiotherapy, but now it is not like that. It is now called as a precision medicine or the patient centered medicine. So the medicines will be tailored to a particular type of carcinoma breast. We are not just say it is a carcinoma breast, and there are molecular ways depending upon the tumor markers, like whatever, whenever we do a biopsy, we do a estrogen receptor positivity, or the progesterone positivity, HER2 receptor positivity, and K67 value. So these four parameters are done a molecular analysis, and based on that we have a different group: luminal A, luminal B, and basal HER2. These are the different four varieties of that. This is a one model. Clinical model, we say it's a early breast carcinoma, LABC, locally advanced breast carcinoma, or you are going to say metastatic breast carcinoma. There is a three models the clinical side. When you are examining that, when you are saying that it is a size has crossed 5 centimeter, the tumor size has crossed 5 centimeter, and the metastasis has taken place, it has gone to the lung, it has gone to the spine, then we call it as a metastatic carcinoma. But more importantly, it is here. So what is the important? Suppose the tumors, when you are ERPR positive, the treatment of you are going to entirely change. Told in the beginning, the carcinoma breast is a systemic disease. So if it is a ERPR positive, we are going to give a hormonal therapy. If you are ERPR negative, the more chances of you are going to get a chemotherapy. HER2 receptor, you can get a trastuzumab therapy. And if you are we are highly BR, the triple negative, now that is what now we are getting more cases of the triple negative, ERPR negative, HER2 negative. That is more hereditary case, that is a more dangerous case. So now molecular profiling is a advancements which is there. So now what we talk is a precision medicine. So each individual will be predicted, that is what type of the tumor cells he is having and what kind of treatment which can be given. So that can be managed by this. There are a lot of new tumor markers. Normally, routinely we do ER, PR, HER2, and K61. But now, of late, now we are having a AR receptor, androgen receptor. So far, we have thought that it is only the estrogen receptors are playing a major role in the initiation and the progression of the carcinoma. But now it is also been proved that it's androgen receptors. That is, normally it is a male hormone, but this androgen is also playing a major role. There is a lot of studies are based on that. We routinely do HER2 receptor. Now there is a study is coming HER3 receptor, and HER3 receptor, when we are studying, there is a particular drugs are coming. Patritumab is a drug and which can be given. So depending upon that, why I want to put all that things. So we have a lot of mechanism. And once you having a prevention is better always, and what you can do. But once you are getting a disease, and we can have an early diagnosis, and early diagnosis again, we need to categorize the patient and put them into the molecular profile. And this is the pattern this patient is going to be. This is the pattern this patient is going to be. And that is an advance we having. And once we know you are luminal A, and we are hopeful that we can have a cure disease. But when we are having a triple negative, that is a basal cell, then it is very difficult for that. So more than that, and when you are saying the class model or molecular profiling, and you tend to say that you are more prone, or when your family history is there, your maternal uncle, maternal sister, maternal auntie has got a carcinoma breast, the possibility of you getting that. Then we are going to do a BRCA1 and BRCA2. There is an oncogene model. So when the BRCA1 is tested and when it is showing positive, the possibility of you getting a cancer is very high. So people like that, where they are going to have the high, then we are having a preventive aspect. That is why even when you are potentially prone to develop a carcinoma, we have a mechanism whereby we can prevent. One is your lifestyle you are changing, but also the drugs are also going to help. One of the beautiful drug is a tamoxifen. And when you are going to put the drug for a long time, and we are saying you have very close relatives are having carcinoma, and your BRCA1 is positive, and your the tumor markers are going to be on the right side, and then the possibility of you putting on a tamoxifen is there. Then the extreme form, when there is a BRCA1 is positive in the family, and your one sister has developed, and all the parameters says that you can do, then we can do a prophylactic mastectomy. Normally, the mastectomy is done after you get a cancer, but there is Angela Jolie. I mean, a lot of people has come where they have prophylactically taken their breast out so that they will be able to have a better result. So the prophylactic treatment is these two, or the prophylactically you are having. I mean, but what is most important prophylactic or preventive aspect is a self breast examination. This is one thing is very, very important. Every woman in the country should know about the breast self examination, how you are going to do. And it is not one day, every month you should do, every month a particular day. Probably the after 1 week after the last menstrual day, and that is a time when the breast will be little more soft and supple, that one can do the breast examination. It has to be done in a 3-4 ways: by standing, by raising your hand, standing in front of the mirror and seeing the changes, and also when you are taking bath and seeing the axilla and things. So this is a 4 position you need to do. So when you need to do, now we say the beginning should be at the age of 16 to 18, or mandatorily at the age of 20. So every college woman, everybody should know how to do the prophylactic, the self breast examination. This is one of the mission which is Indian Medical Association, and a lot of doctors are taken as a priority to teach the people, the public, that is how to do the self breast examination. Please remember, and when you see a lump, do not get anxiety, because only 10% are going to be the malignant. 90% of the lump in the breast is going to be only a benign. So, but if you can put it in the early part, if you can diagnose it early, there is always a possibility that you will be able to give a much better cure. So, that is what you get to look. These are the different changes you can see: a thick area, dimple, all that is a thing. But next important thing is a mammography. And now this is a once you are having a self examination, you are not able to see. So at the age of 20 you can start, but mammography we are advising at the age of 20. If you are going to do a mammography, and definitely that is going to pick up with the better various points in that, with the ongo, with the factors like calcification, the changes the mammography will be able to take. So, I mean, I know that is a time is going to out, because there is a lot of newer changes which I'm not going to talk to you. Various other things, but treatment part, and also there is a lot of newer treatment. Never worry that it is only always surgery is a treatment for carcinoma breast. The whole breast removal has gone. Now ablative procedure, non-surgical ablative procedures. Lot of things has come. Whether it can be by using a laser, you can do ablate. By using a cryoablation, we can do microwave ablation, we can do laser, we can do. All these are now the newer techniques of ablative without surgery. But coming to the surgical condition, which what we see the initial, then lot of treatment has improved, because this is time is limited. I'm not going to talk on the various treatment, but this is one area again I want to tell you. We know the vaccines are there for various diseases. COVID, we have said about the vaccine, but now a lot of trials, extensive trials are happening across the globe to bring in the cancer vaccine, and a lot of improvement has been taken place. Now the cancer vaccine is coming in a different form. This is whether it is based on the albumin, it is called lactalbumin based, or that is a one set of human vaccine is coming. Now the newer breast cancer has coming started. The second phase has been done. The mammoglobin vaccine is coming. It is called mammoglobin A, which has 93 amino acid, which is coming. And triple negative breast cancer also vaccine is coming. So for different kind of vaccines, which act and stimulate your immunity to protect your body, or which prevents the development, is coming in. But as on date, it is not still not available in the market. The second phase of the trial is going on. Probably within another 1 or 2 years, I mean, definitely we will get the vaccine. I think once the vaccine is come, and definitely we will be able to be more happy that we will be able to mitigate the incidence of the carcinoma breast. This is one thing. A lot of newer therapies are coming. Finally, I will just talk about the major thing on the surgical management. So initially, this is all the 3-4 gentlemen. Halstadian thought aggressive management, locally aggressive, removing the tumor is the best way. He did a radical mastectomy, removed the breast along with the muscles there. Then the Pfizer concept comes that the breast is not a systemic, local disease, it's a systemic disease. So do a minimum, just remove the breast and give chemotherapy or radiotherapy. But later, this man, Varanasi, is a man who said that why should we remove the entire breast? So, because if you see the 20th century, the entire breast will be removed. Now in the 21st century, we are going a breast conservative surgery. So if you have a carcinoma breast, go into a doctor, and if you want to remove the breast totally, please think twice, because there is no need to remove the breast totally. It is enough that we remove the breast which is there in a particular area there, remove and reconstruct or give a radiotherapy. There are so many procedures are there. It is almost can be done in most of the conditions. So that is the one thing which I wanted to take. So breast conservative surgery can be done. Except when you are having pregnancy, because all the breast conservative surgery should go for a radiation therapy. So pregnancy, or when there's a large tumors like this, that you may not go for that. Otherwise, it's a breast conservative surgery. Lastly, that breasts is also now coming in. So once you do a removal of the breast, it looks very ugly. But now oncoplastic surgery has come in. That oncoplastic surgery is nothing but the plastic surgeon and oncologist working together, and they immediately reconstruct the breast. There are so many techniques of the reconstruction of the breast is there. So depending upon the site where the tumor is there, depending upon the site where the minimum breast conservation, minimal mass is excised, then you will be able to remove the entire things. But exact the contour of the breast can be brought back. So, friends, I just talk to you because I do not want to go for further details because it is already time. The carcinoma breast is this disease which is rampantly increasing. The almost every for every 1 lakh person, that is nearly 40 women, that is 1 in 8 women in the country are getting the carcinoma in their lifetime. So this is dangerous, but to so some extent the God has given an opportunity that we will be able to prevent the occurrence of disease by modifying our lifestyle. One of the most important is your physical activity. You are reducing the obesity, reducing the junk food, avoiding alcohol, avoiding the then breastfeeding. The opportunity for the breastfeeding is there. Always give the breastfeeding, and do not use hormonal therapies too much, or do not take much of frequent the fear go for X-ray, CT scan, all the radiation. So that all should be avoided. And if at all you get a cancer, but do not wait till it goes beyond the control. And if you do the self breast examination, if you find anything that is abnormal, please bring to the doctor, because once the doctor sees it in the early, you can do. We have ample treatment modalities that what we can prevent that. And if you have a vaccine is on the way, probably in a few years we will get a vaccine. So I believe, though it is increasing, that we will be able to conquer the carcinoma breast in the near future and help the humanity to live safely. So thank you very much for your patient hearing. Uh,
Thank you, sir. Thank you so much for the very insightful presentation. Sir, can we take the questions now?
yes, please.
We'll not take much of the questions as we have already crossed the time limit. So we'll take maybe 2 or 3 questions and we'll close the session.
Okay.
Yes, sir. Sir, the first question is, what advancement in surgical techniques have contributed to the early detection and successful treatment of breast carcinoma?
There are so many newer technologies come in. Like that is what I said. It's a molecular. We are going to take not even take a biopsy from that. We can take a liquid biopsy. We take a blood for that, and there we can do the DNA structures and can predict that this woman is having. We can take the gut microbiome, can predict that you are having a carcinoma or you attend to having the having carcinoma, and we are able to classify. So diagnostic technology has so much advanced so that we'll be able to, even at the stage of the few first cycle or the second cycle of duplication, we will be able to get the carcinoma. And once you make it a diagnosis early, it's a 1 centimeter size tumor, 100% that possibility that we will be able to cure the disease, unlike like what we are going to get in the late stage. So always early. So technology is first, but you do self breast examination at the age of 40 onwards. Please start doing mammography. Many young women are not doing, ladies are not coming forward to do the mammography, including the doctors. Now there is a lot of sophisticated mammography machines are coming, especially tomosynthesis, 3D tomosynthesis, which is less painful. You can go take the picture, and once in 2 years, from the 40 years, you must take, and from 50 years, so once in a year, the mammography should be taken. Self breast examination should be continued. Physical exercise should be improved. So we will be able to definitely early diagnose and treat the disease properly.
Right, sir. Thank you so much for this very important tip. And there's another question, sir. How can the healthcare system, especially in rural areas, improve access to breast cancer screening and prevention programs?
Yeah, this is what is very important. It is a responsibility of everyone. In either the government cannot do always the same thing, but every NGO, every self help group of the woman should be exposed to the yearly self examination of the breast concept. they should do the self examination. And when now we have a system in many states that once they have a problem, immediately when they report, even in the primary health center, from there they are tagged, they are brought to for the mammography, they are back for the biopsy, and simultaneously we are doing the surgery. Especially in Tamil Nadu, which what I belong, now there is one scheme called MMT, Makkalai Thedi Marutho. There is a people are going to the house and do that examination and bring the people if there is a positive for the examination. So India is one country we can happily say, even in rural areas, and we have a facility for that. It is only the mindset is not coming. Ladies are not coming out forward. They always tend to hide it. They do not even tell it, and especially when they do not have a children or when they do not have the husband, they are not telling to the people. Only when it is becoming beyond the stage, they are coming to the people. So if the yearly, if you while you are bathing, while you are standing in front of the mirror, and if you see any abnormality which will come, I think it is rural and urban. There is not much of difference. Even in rural area, we have an access for the low level, high detecting systems in the country.
Right, sir. Thank you so much. There's one last question. With the growing focus on minimally invasive and robotic surgeries, how do you see these techniques shaping the surgical management of breast cancer in the next decade?
Yeah, now lot of things. Breast is carcinoma is one where it is a very obvious superficial structure. So people don't do it under the laparoscopy or robotic surgery is not needed. But however, some people have started doing for a nodal dissection, axillary nodal dissection. When there is a metastasis node, the laparoscopy surgery is going to be there. But now the concept is shifting. It is not the surgery. It is not that what you are going to remove is important, because breast carcinoma is not a surgical disease alone. It is a disease which is going to affect the entire part of the body. And even if you do a surgery, if you are not going to give a radiotherapy, you are not going to give a chemotherapy, you are not giving to the other drugs, and the treatment is not going to be good. It is a combination of many things. So I will not say it is a surgery alone can prevent this, but a surgery, yes, it is important, but additional systemic therapy, all it is a multimodality, all joining together, put our efforts, definitely we can get a good result.
Right, sir. Thank you so much for answering these
Thank you.
queries. And yeah, so with that note, I would like to sincerely thank you for the incredibly informative and engaging session. And especially, I appreciate the way you have highlighted the points such as a self-breast examination, which has provided a like actionable takeaway points, which all of us can implement in our lives. So thank you so much once again, sir, for your precious time and for this insightful webinar. Thank you, sir.
Thank you. Thank you. Thank you.
Thank you. Thank you all for joining us and giving us your precious time. Thank you, Parul Pal. Thank you, Vinayak Sharma. Thank you all. Thank you.
Thank you.